Hi everyone, this is Kate King, and today we are talking about the very important intersection between mental and emotional health with physical pain and illness and diagnosis. So, this is a really important thing that I don't think is talked about enough. How, when we are in physical pain or extreme discomfort, or when we're provided with a physical diagnosis or illness, how that really affects our mental health. And it can make people feel increased depression, anxiety, overwhelm, stress, and grief to know that their body isn't functioning quite in the way they're used to, or if they feel like there's a fear or a threat to their security, it can really influence mental health. So I want to talk about 3 different techniques today for sort of building a bridge between mental health and the reality and the inevitability of physical pain in the body. So, first and foremost, I'd like to start with talking about a meditation and mindfulness practice. So, meditation is something that always has so many benefits. I've got some videos on meditation and some guided meditations to kind of get you into it if you're interested in that. But mindfulness is something that you can use without a formal meditation process. It essentially involves becoming embodied and feeling the sensations and really sort of leaning in and allowing yourself to experience the way that your body feels and experiences things without the interference of the mind and the analytical process of your thinking. So what this looks like in terms of pain is, instead of the kind of impulse that we have to just run away from our pain and not feel it and just sort of label it as suffering, the mindfulness lens would instead invite you to go into your body and explore the sensations and the physical experience of pain in your body. Sort of come closer and face it and look at it and start to learn what that pain is holding and what it has to show you about yourself. So ways to do this are, first, just exploring where you feel the pain. So if you have an acute sensation of pain, it might be easy to pin down where you feel that, but sometimes pain is kind of a reverberating experience through the body. And so really noticing where that pain lives and how it moves, because pain is not a stagnant experience. It tends to sort of go in waves and move through you. So if you can notice the way the pain moves, or if it's a pulsing sensation, if it's a stabbing sensation, if it feels sharp or dull, you might even be able to associate a color or a heaviness or density with your pain. Or you may be able to notice that your pain has different qualities, like there might be a texture to it or a sensation involved with shifting your body in one way or another. And as you explore your pain, you'll learn a lot more about it. And you'll learn that when it does move in those waves and come through you, that there are opportunities, that pain is not a continuous experience, even in the most chronic kind of pain situations. And so you'll learn how to find the breaths or the spaces in between the waves. A good example of this is for anyone who's ever given birth. The feeling of contractions during childbirth, right? So if you think about the concept of childbirth in a cognitive way, your mind is going to immediately just label this as suffering and pain and discomfort, right? And that'll be your experience. But if you can go to a more embodied place and realize that those contractions come and go, and there are incredible peaks of pain and discomfort, and there are also areas of decline with that pain and even complete resolution of the pain and kind of pockets of relief. And it's really important to notice these pockets of relief with chronic pain, because these moments of relief allow us to resource and kind of encourage ourselves for the next big wave. And so if you miss these pockets and these little breathers in between the waves of pain, then you also miss the opportunity to support yourself in small ways through the process of pain. That pain is not just one large situation, it's a series of moments, and each of those moments carries a different degree and intensity of that physical sensation. So I wanted to share with you today the work of Pema Chodron, This is one of her books, which I absolutely love. And she is a Buddhist meditation and mindfulness teacher, and she speaks a lot about leaning into the experiences and fostering a sense of self-compassion and acceptance with the reality and the inevitability of pain in life, physically and emotionally. Two other of her books that I think are just really incredible are When Things Fall Apart and The Places That Scare You. So down below in the comments, I'll add some information about her website and her books for your further knowledge. Okay, so piece number 2 about building this bridge between mental health and pain. I want to share with you one of my parts cards. So these cards, you could scroll back if you haven't already into my homepage and find the video I made on parts cards. So essentially this is the practice of identifying and exploring with different parts of the self. And what I want to share with you today is the parts card that I made around the fragile human. So this card really exemplifies in the front with the experience of the fragile quality of the human body. And on the back, I've done some writing to further deepen into that experience and that exploration of the fragile human part. So I believe that each of us have this fragile human part of ourselves. This is the part of us that can't stand pain, wants to run from it, is afraid of it, wants to feel good, and wants to be healthy long term. This might be the part of you that looks back at your more youthful years with a sense of nostalgia and really remembering that you used to feel better and now you feel worse. So when you're flooded with the energy of this part, then it feels like you are completely saturated in the grief and the resentment and the anger and sadness that's resulting with having pain or a diagnosis or an illness in your physical body. But to be able to realize that this is a part of you, it's not the entirety of who you are, then you can create some space between me and the part. And so I can look at this part from a true self place, and I can see that it feels charged and it feels activated during a moment of increased pain or during a time of diagnosis for a reason. And so this part has come up to let us know that we feel this pain and it's uncomfortable, and it lets us know that there's a contrast between the pain and the discomfort we feel and our sort of pre-pain state of feeling okay and being able to move through our life without that discomfort. So grief like this is really valuable in understanding and appreciating our life and having a sense of gratitude and value for the things in life that do feel okay, even when there's pain, to be able to say, yes, I am a fragile human. We all are. None of us are bulletproof, right? We all will experience pain and discomfort in life. That's part of why we're here. That's a reality of having the physical body, and being able to really see that part of you and work with it allows you to foster a deeper sense of self-compassion and acceptance for the human condition, both within yourself and in others. And when you can access that kind of compassion for that part of you, then it doesn't feel so much charge, and instead it can soften into that compassionate experience of, okay, there's pain, and I have a diagnosis, and I have something in my physical body that's uncomfortable. How can I support myself in that? And so this leads me to my third tool for building the bridge from emotional and mental health with physical pain. So this is resourcing. So resourcing looks like bringing in and collecting anything in the world and inside of yourself that feels supportive to you. So resourcing might mean reading, listening to podcasts, meeting with doctors, going to classes, things that can teach you more about why you're feeling pain and help you understand in a cognitive sense what's going on in your body so that you can support yourself in that reality. Resourcing also looks like people. It involves intimate connection and meaningful conversations with other people and being really thoughtful and intentional with who you bring into your life to support you when you're in pain or when you have a deep and dire need for support. Making sure that the people that you're reaching out to are willing to help and that their help feels good and aligns with the kind of help you need. And speaking of help, it's really important to ask for help and also to be willing to receive the help that is being offered. So when you're in physical pain or you're dealing with a diagnosis that inhibits you, it's important not to overextend and stretch yourself in areas that will cause more pain, but instead to ask for help and to receive that help so that your life can be made easier in whatever way possible to sort of counterbalance that teeter-totter of the physical pain that you're experiencing. And lastly, it's really important to integrate a self-care practice when you're experiencing physical pain. Self-care is anything that you can give yourself that helps to make you feel more supported, more nourished, more resourced, and more cared for. So this can look like a walk outside or fresh air and sunshine. It can look like meeting with a friend. It can look like not meeting with a friend and taking time to yourself, reading fantasy books, watching movies. It can also be a form of active self-care like journaling or art making to delve deeper into making meaning of the pain and the discomfort you're experiencing. Going to therapy is self-care. Treating yourself to healthy foods or decadent desserts, whatever feels good in that moment is okay. There's active self-care and there's passive self-care. The active self-care techniques are like doing things that feel like they're gratifying and satisfying and deepening into your understanding of yourself. And the more passive self-care techniques are like taking a nap or watching a movie or reading a book, things that feel more soothing. So it's important to have a balance of the active and the passive self-care techniques because too much on either end will start to feel imbalanced. So whether you're an athlete and you're dealing with a sports injury and the pain associated with that, or if you're a person who's been diagnosed with cancer and you're working through the pain of the cancer itself as well as the medication that's treating your cancer, or perhaps you have a long-term chronic pain illness like rheumatoid arthritis or another autoimmune disease, I want you to remember that pain is a normal and natural and inevitable part of being a human being. And by implementing mindfulness and the parts work with the parts cards and having self-compassion and self-awareness and acceptance and building as many resources around yourself as possible, you're going to give yourself the best possible chance to keep your mental health strong while you're navigating through the difficulty of physical pain. So please subscribe to my channel for more great content here, and thanks so much for being with me today. Take care.